Hope Worldwide Jamaica is a registered charitable organization duly formed under the laws of Jamaica. It is affiliated with Hope Worldwide, a US-based charity with projects in over 152 cities across the world. In Jamaica, Hope Worldwide has been providing free or low-cost medical care and health education to many Jamaicans since 1994 through its clinic at the Mary Issa's Children's Health Center at Heroes Circle in Kingston and also at some government health centers and clinics across 4 parishes.
The major aim of Hope is to use non-traditional resources to help provide for health, especially in our country. We found that going out to our different clinics that there's a lot of chronic disease and there's a lot of stigma about HIV/AIDS. So one of the things that we thought would be very helpful in our program is not just to focus on trying to cure disease, but prevent it.
According to the director of Hope Worldwide Jamaica, Dr. Peter Swaby, along with the children and mothers treated at the clinics, the average age of the patients treated is 64 years, many of whom are living on pensions.
Currently, we are working with 11 communities. One of them is a fixed community, that's the Fletcher's Land community right on Hero Circle. And we serve a population of about 20,000. We have people coming far and wide from Almond Town, from different areas, from comprehensive side, and a lot of the areas downtown, including as far as St. Thomas and St. Catherine. So that's been one of our contributions. We've seen since our inception over 160,000 poor or less privileged individuals. That's our primary focus. We ask for a donation of about $100 in our rural clinics, and in our fixed clinic at Fletcher's Land, our donation structure is about $200 per visit. Now, we don't turn back anybody if they genuinely can't afford, but we ask people to contribute to help our cause.
Claudette Patterson, the general manager of Hope Worldwide Jamaica, mentioned some of the services that are available at the clinic.
At the clinic, we run a number of specialized clinics. We have general clinics. We also have prenatal and postnatal clinics. We have chronic diseases clinic. And these are at different rosters throughout the week.
Hope Worldwide Jamaica intends to extend its projects to several communities across the island, but according to Dr. Swaby, that is not possible for now because of financial constraints. Claudette Patterson, General Manager of Hope Worldwide Jamaica, pointed out that the programs of Hope Worldwide Jamaica need more funding so that the organization may reach a wider cross-section of the society. She added that the organization's projects are being financed through various sources.
That in fact is the significant part of my job, which is to literally go begging and looking for different sources of funding. We have been fortunate over the years in that we've had a consistent back of funding from institutions like the church. We also have had funding from institutions like the Global Fund and also from Chase Fund and from the Environmental Foundation of Jamaica. We're also a part of a worldwide organization, and through those channels we have from time to time receive funding to keep the clinic here at Mary Issa going, and also to keep our mobile units which visit 11 other health centers in St. Catherine, St. Thomas and St. Andrew, providing full medical services, doctors, pharmacy, ECG and other tests. That takes a significant amount of funding.
However, Dr. Swaby said more funding is needed, adding that in April last year, the organization was faced with a decision of closing the medical clinic due to the lack of funds.
Luckily, through the assistance of some very spirited women called the Women's Leadership Initiative, they were able to help us put proposals together for local organizations and funding agencies such as Chase. as well as raise funds for us from private citizens to help us do our work in our medical clinics. And so there's a tremendous debt of gratitude that we owe to the Women's Leadership Initiative. During that time, not only did they provide for our funding, but we also got some assistance from churches in London who were able to help us get our funding together. And right now we are we're at the end of another year in terms of our financial year, and we're looking for new international agencies to fund us.
Violet Harrison Brown, president of the Fletcher's Land Senior Citizens Club, where the Mary Issa Children's Health Center is located, said Hope Worldwide Jamaica is contributing immensely to the quality of health care in the community. She added that when the clinic was having financial difficulties last year, the club contributed to keeping the institution open.
I am a patient at this clinic from 1985 and came to clinic one day, and Dr. Swaby told me that the clinic is experiencing financial difficulties and it might close down. Being a patient for so long, we didn't want it to close down. So I went back I am the president for the Fletcher's Land Senior Citizen Club. So I went back to my club members and told them about it. So we decided to keep a fish fry, and we said that the proceeds we would give it to the clinic.
As a voluntary organization, the work of Hope Worldwide is dependent on a number of volunteers. Director of the organization, Dr. Peter Swaby, is appealing to Jamaicans to contribute to the projects by becoming volunteers.
Anybody can be a volunteer. We have several different programs that you can volunteer for. If you have no training and very little skills, you can volunteer in our children's homes, as we go into children's homes to assist children on the weekends and just spend time and play and stimulate them and just provide mentorship for them. If you have some basic skills and even skills that we can impart to you in our HIV/AIDS prevention program, you can join us on our team and go out to different schools. If you're an adolescent that has a story to share, we can use you. If there's some positive influence that you want our students to receive and you feel like you have a place, we can use you in our during the week, during our schools program. And then if you are a medical volunteer or you have any medical skills, whether it be nursing, practical nursing, a technician, a pharmacist, a doctor, we can use your skills in our fixed clinic in Kingston or even in the locations that we serve outside of Kingston. It just depends on what your schedule is.
For further information on how you can be a volunteer or donate to the projects of Hope Worldwide Jamaica, you may contact Dr. Peter Swaby or Claudette Patterson at 7 Oxford Park Avenue, Kingston 5. You can also telephone 876-754-444